say health is wealth, and today we are here to discuss innovation in health. We are right here at the Infectious Diseases Institute Virtual Reality Lab, and I have a great team here, and today's conversation is going to be fruitful. My name is Brandy Valentine Azeire, Communication Officer, Ministry of ICT and National Guidance, and welcome to the Ugandan podcast. Welcome to the Ugandan podcast.
Thank you.
Today we have a set of doctors in all fields, and they'll introduce themselves one by one, starting with Dr. Rosalind. Please introduce yourself.
Good morning. My name is Dr. Rosalind Ratanshi, and I'm the head of research and development at the Academy for Health Innovation here at IDI.
All right. And you are?
Dathan, Byonanebye. I'm also a medical doctor and the acting deputy head of global health security at the Infectious Diseases Institute.
Titles are heavy. Let's keep it rolling.
Let me make it simple.
Yeah.
Good morning, I'm Dr. Balaba, and I'm the Business Development Lead and Partnership Lead at the Academy for Health Innovations at IDI.
Okay.
Yes, and I am Dr. Ruth Obaikol. I am the lead on impact and scale at Academy for Health Innovations here at IDI.
All right, so you're doctors doing all these other things in the field.
Yes.
Before we get into this conversation, I'd like to let you know that you can catch this podcast on all platforms, including Riffly. So feel free to head there when you're getting your next episode or this one. Dr. Rose, allow me to call you Rose. No. Dr. Rose, what can you give us, what's the vision and the mission, and how do we relate to the Infectious Diseases Institute coming to life?
Thank you so much. So the Infectious Diseases Institute vision is a healthy Africa free from the burden of infectious diseases. And just so that we situate what we mean by infectious diseases, it's those things that we can catch from each other or we can catch from animals. So we started work actually doing HIV at the time when we needed to train lots and lots of doctors and nurses and healthcare workers to scale up the delivery of antiretroviral drugs across the country. And from there, we've extended into, as well as training, into research, into clinical care, for other conditions as well, such as Ebola and COVID, TB, malaria, anything that is affecting us that's infectious. And as well as the work that we're doing in research and training, we also have health system strengthening. So what we are doing in that is we're working with our partners in Ministry of Health and other ministries like ICT to make sure that we are contributing to the national programming around health. And our health system strengthening involves working with those partners hand in hand in places like West Nile, in Masaka region, in Wakiso, to support the government health facilities with the activities they're doing in infectious diseases.
Awesome. That's a great background. And now I want us to get into the conversation about innovation. Dr. Dathan, how do you involve the local communities in the development and implementation of health innovations?
That's a great question, and it's really not well understood in our setting because, you know, the innovations and technology have just arrived in Uganda, but what we know is that we first need to do a community needs assessment. And the definition of the community in this context is defining the end user community. For example, if you're looking at precision medicine, you need to engage the doctors, and the goal is to understand what are their needs so that the innovation is actually addressing the needs of that community. And then the next thing is to co-design with the community. Sorry, apologies for the sound.
We have some water.
Okay, yeah. So the next thing is to co-design with the community, again, to just make sure that the product you're innovating has better usability. It's going to be usable by the community. And then the next important thing is to make sure that the community is empowered to have the best outputs of the product that you're designing. And that's critically important if you're dealing with our, rural communities, for example. You don't want to innovate something and then you find the community is not going to be able to use it.
Yes,
because that can be very
yourself.
Exactly. You end up innovating for yourself. Yeah. Sure.
But also, what we define as community goes beyond just the end user. We have a spectrum of what we call community. Yeah. And within the institute, we have a mandate of having a community advisory board. Yeah. So in our research and implementation, we have a central group of people that we have identified over the last 20 years as IDI that inform everything we intend to do and innovate.
Yeah.
So that spectrum of community has stakeholders, key stakeholders like the Ministry of Health, patient groups, key populations. It has students. It has the elderly women and the older people that we recently had an aging pictures of aging program with. So we look at community as people we need to engage with actively. So it's a spectrum, and we are very intentional as an institution to have a community advisory board, and it's one of the pillars that has guided us in most of our innovations to scale. So we have someone who leads that effort and engages them in every single activity we undertake as an institute.
Actually, that means you're inclusive from the children to the women to the youth to the elderly, and I can imagine that would cost a whole lot of money and a whole lot of manpower. So, which will bring me to the question I have for you, Dr. Martin. How have you leveraged on collaborations and partnerships to bring innovations in health to life?
So, to bring innovations to life needs collective efforts in terms of capacity, in terms of infrastructure, in terms of financial resources. And so it is testament that IDI, the success that we've had and registered over the last 20 years, has been really hinged on collaboration. And you'll see we started out, I'll give an example of the Academy for Health Innovations and the space we're in. The Academy for Health Innovations was established through a partnership, Ministry of Health, Johnson & Johnson, and IDI. And so the initial funding that saw most of the money that came in was to support community-based organizations. So we had quite a number of capacity building activities to make sure they have their financials in place, technical capacity in place. So given our experience as researchers and implementers, we were able to support them beyond just them doing rudimentary ideas. And now we have more than 20 established community-based organizations out of the efforts that initially established the Academy. So we work with the Ministry of Health, the Ministry of ICT. We are not a know-it-all entity. We leverage each other's capacities within the country, the region, and then external funders, CDC, USAID, Cambridge University, and a host of other organizations.
I think I should come and work here.
So on top of Martin's point, so the Infectious Diseases Institute is located within Makerere University. It's actually a research institute of Makerere University. So we work very closely with the academia, and we work with the College of Computing. We also work with the College of Health Sciences, in which hosts the institute, because the academia is very good at scientific reasoning and bring the ideas, and then we innovate through those ideas to develop the products.
Yes. Actually, I think some time back, it could have been last month, we were here at the School of Science, at the Computer Science, and they were opening an artificial intelligence lab. Yep. And our permanent secretary, Dr. Zawede, keeps emphasizing how we need to work as a group, right? Yeah. Government, private, academia, civil society, development partners. And I like that you're using that approach. Which will bring me to you, Dr. Ruth. How do you ensure, what steps do you take to ensure that these innovations are, one, accessible, two, equitable?
Yeah, I think that what Dathan and Martin have talked about is actually the beginning point and central to defining whether that innovation will be accessible and equitable at the end of the day. First, are you answering a real problem that is in the society? It's not just that you've interfaced with the healthcare system and you've had a problem personally, but is it a problem that is, within the community? Is it a problem that many people experience? Is it a systems problem? Is it what people want? And so it takes into consideration the fact that you might need to actually do a proper baseline assessment or have a research question that is answering a problem that is there in the community. So the way you start with it is very important. And then the next step is definitely when you start developing, do you have the capacity? And that's where collaborations again come in. You may have the idea, you know the problem, but you don't have the capacity, the full capacity as an individual.
Oh, so you're able to build phases and live out?
Yes. Okay. So you need to work with people to help you make sure that you're getting an innovation that, is well developed and can be utilized. The next step for me would be to evaluate and test it. Does it actually work in a controlled setting? And can you then, publish a document that shows that there's evidence that your innovation actually works and it can work in a given setting? Then you probably need to incubate it and integrate it within a setting, test it out in a real-world setting, in probably a small pilot. I know the ministries don't like pilots anymore because you're tired of them, but I think we need to bear with each other and bear with the innovators, because pilots need to be deployed. We need to see that these things are actually working in a real-life setting. And then, of course, take it to scale. And now when you go to scale and you've taken into consideration all those things, the community, the users, you've tested it, there's evidence, you've published and people know, and you have disseminated your findings, it is likely that your innovation at the end of the day might be used and might be adopted and can be scaled. But of course, you need to take into consideration the cost. If I put out an innovation there, will people be able to afford? And so you need to be able to, redefine and, make sure that it's affordable, but also that it responds to all the needs of people, for, people in the rural setting, people in the urban, all your demographic. You need to really be thinking. So it's not a simple thing, but that's why we are here as the academy.
Yes.
We have tried some of these innovations, we've done them, they've gone to scale. So we have a bit of this, and we are here to handhold. And that's why the HIC is also,
We are going to get into the HIC, and I'm so excited for it. First and foremost, it's going to be the first and for the inaugural health innovation.
It's going to be the 5th edition.
5th edition. Well, it's going to be the first one. I'm going to be attending.
Yes.
Yeah, and so I want to move back to Dr. Rose, right? For the time you have been in Uganda, what do you love about Uganda?
What do I love about Uganda? Okay, I've been here for a long time.
How long? You may be qualifying to be Ugandan by this point.
No, absolutely. I've been here for 20 years. I'm married to Ugandan, all of the blah. What do I love about Uganda? First and foremost, actually, everybody in Uganda.
Yeah.
Like the joy that you see every day. I was just saying to my kids in the car, we were stuck in traffic we had some visitors we were taking to Andire Center. We were stuck in traffic for like 20 minutes. And there was a guy setting up to do his Rolex stand. And he had his headphones on. It was raining, it was getting dark, everybody was miserable. This guy was like setting up his Rolex stand with his headphones on, and he was like dancing and just having his own joy. Like, there is joy everywhere in Uganda. That's the first thing. So people, and then the country is just beautiful. Like there's so many beautiful things everywhere in the country.
Yeah.
So.
Did you have a good time at Ndere when you arrived?
Oh yeah, I mean, I take so many visitors there, because it's such a great kind of showcase for it. It's brilliant. Yeah.
The cultural performances are really awesome. Dr. Dalton, Dathan.
Yeah.
Dalton, Dathan, Dr. Dathan.
Same names, yeah.
No, they are not. My apologies.
Right.
But what do you love about Uganda?
I think I like the nature. I've traveled to almost all the national parks.
All of them?
Almost all of them, except Kedepo.
Yeah, and me, we'll put
Kedepo,
together.
I think I'll hang on for that one.
They are stunningly beautiful. I think if you go to Mugahinga and see the chimps, and then you look at the forest, the nature, absolutely stunning. And most Ugandans actually may not be aware, but Uganda is incredibly beautiful. Yeah.
We had the first daughter, Ms. Diana Charimira, the other time talking about local tourism. She was saying, instead of going to Dubai, pack a bag and go to...
Absolutely. We burn a lot of money going outside countries, but there's a lot of beauty outside there, yeah.
So when you're going to Chidepo, I'm coming.
We'll do another podcast and get it.
Yeah. Dr. Martin, what do you love about Uganda?
I think for me, I do agree with everything you said.
Okay.
For me, it's a beauty in diversity of people. From north to south, central. It's you experience Uganda in different ways, and I think the common thing about it all is the welcomeness of people, and it's very welcoming, and you can't even make sense of it because it's not. The experience is different when you go to certain places, but For Uganda, we are quite diverse, 54 plus languages and people and tribes. But in all that, there's something different they put to you. I did my university, Balaba University, and it's for my first time to go to the West. I didn't want to leave to come back to the Central, but
You were milk at and honey. Yeah, I am glad. Dr. Ruth.
Yeah, I totally agree with Rose and Martin. I love Uganda for the people. I can't trade my country for any other because of the people. Very warm, and I like the jokes. People joke about. Sometimes, we joke about everything. I don't want to say much about, and I think it helps us survive some of the tough circumstances. I mean, during COVID, people joked about COVID, and we got through it somehow. I think it was good for our mental health. So for me, it's the people, and then the food. I failed to maintain my weight because I think the food is good.
What food is that you're eating that you can't let
go? Ugandan food, and I mean, Martin is talking about diversity.
Yeah.
At my home, I eat food from the east.
Which one
I'll
is that?
eat a tap.
A tap.
Ebo. Green vegetables with peanut butter and all these things. And at work, I like to take the Baganda food. So
the matoke rice and
chicken. So but it's tasty. It's good.
And the fruits. Don't forget the fruit.
Yes, absolutely.
Yeah, the fruit. Nowhere in the world has better fruit.
I'm glad to hear this. I hope whoever is watching should be able to try out all these things. I want us to get into a sentimental topic, and I want to start with Dr. Martin. The Health Innovation Conference. Now you almost killed me for saying it's the first year, it's the fifth. Let's get into it. What is so exciting about it? Why should I attend for my first time?
So this is the 5th edition.
Okay.
The first edition was in 2018. And when we came into the space, innovation in itself is nascent to the country. And all the efforts to make sure that we have innovations come to life a bit nascent. So by the mandate of the Academy and IDI, we always want to contribute to national programs and roadmaps. So having been within the healthcare space, we wanted to consolidate all those efforts to make sure that we have the highest death rate of innovations because we don't have a consolidated ecosystem. Stretchy is the word. It's quite redundant, but I would say that. So given our experience with healthcare and the fact that we have built our depth of relationship with the Ministry of Health, we have core understanding of the needs of the ministry. So we wanted to see how best we can deliver healthcare by leveraging innovations, but we can't do it alone. We need the efforts of everyone, public and private sector, and everyone who's involved in healthcare, directly and indirectly. So in 2018, we just started like, guys, let's just come and talk and figure out what's the ministry's roadmap. Who are the supporting ministries, the efforts of the Ministry of Health in innovations? You have ICT, you have NITA for infrastructure, you have all these people, trade, and they don't talk. We as scientists, we do a lot, but we don't translate research into innovation at all. So we came into this space to solve a kind of complicated problem, but with solutions all around us. And those are the people, the collaborators. So from policy to financing to now embedding what we've been building into national systems. It's exciting because it's been a journey of let's talk, let's identify problems, let's support each other. Let's get people who are out of, our Dr. Rose will call it visual line of sight when she talks about drones. We have medical drones now. So seeing the conversations and tracking where they came from to now birthing reality of now we have innovations embedded into national systems. We have drones delivering ART within Kalangala. We never thought about it in 2018. But because of our being intentional to bring everyone on board, we have been able to see students coming with ideas and now into systems. So now the excitement is, can we hold it together to make sure that we continue to support, but again to see these things being deployed into systems. And finally, can we make sure we create business models? Dr. Rose will talk about, the kind of thing we're trying to think about now. Can we support people to spin out products? Can we try to make innovations be commercially viable? Can we try to sort out the financing? Can we leverage the Ministry of ICT, Trade, to make sure we have the linkage of industry to universities and research to make sure that now whatever we do is more informed, because by identity we do a lot of evidence-based research for innovations, and we've done that for a couple of people. Now we want to see them into systems. Yes, Dr.
No, I was just going to say, so I think that one of the things that you asked about was community, and one of the things you asked about was partnerships. I think if you're a young innovator, what might be your challenge is that you might be sat at home with your laptop and you think you've got a brilliant solution, but you don't have any way of talking to the doctors to see if it's going to work, or you don't have any way of talking to Ministry of Health to see if it's going to work, or you don't even know whether your jaja in the village is going to be able to manage what you're talking about. And you think you have the solution to all the world's problems in your laptop, but actually you need to talk to other people to see whether this is realistic. And that's one of the points of the Health Innovations Conference, is if we can bring people together and people can actually talk to each other and share their challenges and their ideas and their suggestions, we get much better innovations by being able to talk. But it's also the hope. If you are that innovator and you've got your laptop and you've spoken to these other people, what Martin is saying is starting to see innovations that have homegrown in Uganda now going to being rolled out and taken up by the ministry and being used. It also gives our youth a hope that they're, that it is worth trying to do it instead of, like tourism in Dubai. We don't want them to get jobs in Dubai, right? We want to grow things in country for our country, right? So that's another, real motivating factor is, can we get people in front of each other to have these real conversations?
Okay. Dr. Dathan, what's your take on the Health Innovation Conference? I mean, I'm very sure, unlike me, you have attended many more. What have been the peaks and what do you see moving forward come August?
I've attended 2 previous Health Innovations Conference, and for me it's a fantastic idea. And like Dr. Lowe said, it's an important avenue for young people to talk to one another, learn from one another, but also it's an opportunity for young people to see what kind of opportunities exist beyond their line of sight, what Martin called understand and listen to what the government is planning, what's in the pipeline, what's the private sector thinking about, so that they can now start tailoring their innovations to address the government priorities. So it's very important in that aspect, since it involves all the kind of stakeholders and bring them to on table to start talking to one another, and then of course the young people learning from one another.
And also because if you look at what really still bothers us is we're on the hill, and for the last couple of years Makerere has existed, we don't have too many patentable.
Did you call 100 years a couple of years?
Yeah, because we have 1,000 to go.
Can make a good comeback.
So we are very heavy on research. The translation of that research off the shelf into product and commercialization to actually transform economies. Because I do not know of any country whose economy is not transformed by academia and higher centers of learning and innovation. So we are trying to create this space, because we even intend to go retrospective and say what research is sitting on the shelf in Makerere, in Gulu, that actually has commercial viability. How do we now get it into life? How can it fit into your laptop? How can it fit into your, even if it's just a basic glass? So we still have, that is what keeps us awake. We have a lot of work to do, but now economies have evolved and we have more support. We working with the Ministry of ICT, we trying to make it work together for us. Until we get the patent index of Uganda higher than, because right now it's less than 50, we still have a lot of work to do. And the Innovations Conference is that mandate that we have to make sure that we create that platform that enables this to come to realization.
And I'm actually glad that you have actually brought out that point about the patent index, because you've been preaching about intellectual property left and right. And also, the Ministry of ICT under the government of Uganda has been able to set up innovation hubs. We have one here at Makerere, the Innovation Pod. We have one at Muni, one at Soroti University, one in Kabale University. So when you bring out that point of we want to be able to reach out to these other universities and just see what can we get out of everything, that's really awesome. Dr. Ruth, you want to tell us when the conference is going to be? What should we expect?
That's a very good question for Martin. but the Innovations Conference will be in August, 26th to 28th at Serena, and everyone is welcome. Innovators, investors, all sorts of stakeholders from the Ministry of Health, and we are glad that this year we're working with the Ministry of ICT. Everyone who consumes health, innovates for health, works within the system of health, and cares about their health should ideally be there on the 26th to 28th. And the theme, I think I should hand over to Martin to represent me better.
So the theme is integrating innovations into systems and programs, healthcare systems and programs. And the approach we're taking is different. We are heavy on collaborations. So you will find that even the way we set up the sessions, we have representation for everyone. And I'm happy to say that the Ministry of ICT has endorsed the conference. I think that's why we're here also.
Absolutely.
And so we are really grateful.
We're great team players.
And it's impressive to see the minds in the Ministry of ICT and these other government agencies. They're very intentional to get things done. So during the conference, it's going to be partners running sessions. So we have approached Conrad and Noah Stiftung to do the policy and for healthcare innovations. We have Stanbic Bank through Fly Hub who are going to do the whole session on financing. And we're speaking to other partners. We are going to work with NSSF High Innovator. They're going to literally shape their own session. So ours is to implement the mandate to bring everyone together. And then everyone makes sure they tap into that depth to create that value. And at the end of the day, we're working to ensure that we have the key government and donor agencies to make sure that we have a collective voice from all the public and private sector. All the university pods and all innovation hubs are going to be part of the conference, and each will have an active role. So our role is to coordinate that effort for everyone to have value for their efforts.
So is it free?
So the approach we have taken is to understand the national census. If you have looked at it, 89% of the population is under 18. And with the current economic situation, we wouldn't want to put a price to that particular age group. And yet they're the target. So through our partnerships, we identify resources to enable about 200 to 250 of those to attend for free. So for the target population, the young innovators, it's absolutely free. And then for the working professionals,
the likes of you and Dr. Dathan.
The working professionals. So it's 100,000. But we are also intentional on making sure that we implement regional mandates. So for East Africans, it's a flat 100,000 Ugandan shillings per day. Our visitors from away from the regional bloc, it's $50 per day. I'd like to say that we started out as Ugandan conference, and now we have representation from all over 18 countries. So it's not just a Ugandan, and we want to bring the likes of Microsoft, Google into, as we grow, to make sure that we have now bigger industry speaking into transformative solutions, but with local participation.
Thank you very much. That sounds so awesome. Dr. Rose, as we are talking about these conversations about innovation and in health and everything, do you have any success stories of some innovations that we have had and have been able to roll out and are causing valuable impact?
Thank you. So, of course, we're very excited through this journey to have had solutions that, as Dr. Ruth said, come from problems that we find in the field, but also are context specific. So they're using technologies that are readily available. So at a national level at the moment, we have a tool called the Art Access tool. And what this enables to do, and this was software developed in country with the Ministry of Health, and what this enables people to do is those who are on antiretrovirals who used to go to the normal health facility with all of the queues and the busyness that the health facilities have, they can go and pick up their drugs quickly and efficiently from a community, a private pharmacy near to their house. So that means that there's a quick in and out. They don't have the waiting time, and they're getting a convenient service, and they don't have the travel times and the costs of traveling to these pharmacies. So that's working around the country, and about 50,000 people in over 180 pharmacies are picking up their drugs in that manner, and it's continuing to scale up. So if anybody's interested in getting your drugs from your community pharmacy, you speak to your health facility, they can put you on the program.
How excited you are about it.
It makes such a difference. Yeah. The queues that people used to have to go to because, a lot of people need help. Being able to quickly just go into your local private pharmacy, community pharmacy, and pick up your drugs quickly is a really, you don't miss a day off work. It doesn't cost you a lot of money to get there. You don't see your entire aunties and uncles and have to explain or pretend or hide, the stress of that, seeing a lot of people in one big place. It's a really positive innovation, and we're so happy that we're working with Ministry of Health and PEPFAR to scale this up countrywide. So that's one thing that's on a country-wide basis. We also have a really cool tool that we've been using for lots of different uses called Call for Life.
Call for Life.
Call for Life. And this uses a simple phone, a katochi, right? You don't need a posh WhatsApp phone, you just need your simple phone. So for us in Kampala, it's not a problem having internet, right? But if you're in the village, your katochi is what keeps you going. And what this does is it can provide health information. It can provide reminders about your hospital appointments. It can, you can register if you have a problem and you want a doctor or a nurse to call you back. And it can remind you to take your tablets. And so we've been using this for HIV. We used it for COVID to support people coming out of hospital with mental health support after COVID. We've used it for TB, even up in Karamoja. There's a Call for Life in Karamoja that's helping people to stick to their TB treatment. And one project we have used in Chiriandongo, where young people have used the tool, and it's shown a massive impact on getting their HIV under control. And in that one, what we did was we actually gave the young people a cheap phone. These phones are like $10. It's a really simple innovation to allow them to get services. But I can't stop. I know you're moving on, but I can't stop without talking about our medical drones. Because Martin has set us up to talk about this. So our medical drones project comes from, actually, when I did my PhD, I did it in Masaka. That's how I came to Uganda, on HIV back in the day. And I worked over in Kalangala district on all of those islands. And so I saw firsthand how difficult it was for people, how expensive and how dangerous traveling between the islands on those boats. And when I saw drones being used elsewhere in the world, I was like, there is no place better than Kalangala that we need to use these drones, right? This is a perfect solution to a problem that people have on the islands in accessing their medication. So a few years ago, we set up the project, and it takes partnership of all of the projects we've done. This is a massive partnership. Ministry of Defense, Ministry of Health, Ministry of ICT, Ministry of STI, Civil Aviation Authority, NEMA, the community, very much the community, the Meteorological Office, because we have weather stations, like everyone has come together on this project. And what we are doing is we are taking drugs from a health facility and actually landing on the islands to a peer support worker, just somebody we have trained, who receives the medication, and then they give them to the people in their peer support group. So it actually goes directly to the patient, and it's the only drone project in the world that's delivering directly to patients, because most of them are just between health facilities.
That's so awesome.
Yes, it is. And it's awesome because all of these people have moved together to make it work. You know, other countries have even said, you know, how have you got this up and running? It's because actually everybody's walked the journey with us. CAA have walked the journey with us, our other colleagues. And so now we're at the stage where we're going to scale up across Kalangala. So we're hoping to cover the whole district. We've also done some work with COVID samples in West Nile. So we're looking to try and get some funding, because West Nile is another area that has real challenges with big distances and difficult terrain, and, you know, crossing the Nile on the ferry, all of these problems that people have. So we hope that this will grow into a bigger program.
Okay, that's so awesome. We're hearing you talk about Kalangala, Karamoja, West Nile. Dr. Ruth, you aren't lying. This is equitable and accessible.
I think we've got that act together, understanding the whole phase. And we've burnt our fingers, we've learnt along the way, and I think that's what we have.
Speaking of burning your fingers, just to take tell me the truth. What challenges have you faced on the way to getting here?
Well, there's so many challenges.
So many.
So the first challenge is funding for both the innovation but also scale up. And there are not so many funders in Uganda who want to take risk to fund innovation ideas and see innovations come out. And then when it comes to scaling them up, it's another challenge. You have to convince so many people to buy the innovations and scale them up. But that is kind of changing because the government has been very deliberate on innovations. You spoke to that, how so many innovation centers and hubs are being opened up across the country. And in fact, the National Development Plan 4 is going to be very intentional on innovations, especially for healthcare delivery. So again, it goes back to, if you make sure that you engage all the stakeholders, including the ministry, including the private sector who have the money,
the money.
Then you troubleshoot. Then you troubleshoot the funding aspect. But also the other thing is how do you ensure sustainable use of the innovations? Because the innovations are there, but they have to be used. But again, that feeds back into engaging the community, and that is why Martin said that the IDI has set up a community advisory board, but which can be referred by other innovators. If you want to speak to the community, but you don't want to talk to Karamoja, come to IDI and leverage the community advisory board that is here. So that the community advisory board kind of advises you on the idea, on the specifics of the idea, so that it is usable, but also it also advises you on the potential impact of that innovation when you scale it up. And then the other gaps were lack of regulatory frameworks, but the government has sealed that loop now. We have so many regulatory documents in place, whether it's the Data and Privacy
Data
Act.
and Privacy,
Exactly, that was initiated. And there are so many other policy statements on innovation that control the innovation horizon. So there are now better tools and policy documents that guide the innovators. And I think that's very interesting. So the load is set for us to get moving.
Yes. I think from the last HIC, one of the challenges I had from innovators was actually innovating for health and breaking through, regulatory processes, internal review boards, the ethics committees, and then also engaging, with the ministry, because I think people sometimes feel that it's a big entity, requires a lot of patience. Sometimes you come with your innovations and it's, off target. Or it was a problem, but now it's not, and nobody wants to listen to all those issues. So those are some of the other challenges.
Yeah.
Being an innovator, I think for us at Academy, we have recognized that working within the setting of health is the best. We work in collaboration with our clinic. We are here in the health sector. We're in the university. We're in a framework where there's a collaboration with the Ministry of Health. So it gives us a lot of momentum But like Dr. Rose said, if you're an innovator who's on your laptop somewhere, those can be amplified challenges that you might face on your own. Yeah.
All right. I would like that our challenges are not so far from solved, but then also we can meet in the middle.
Solutions.
Yes. So let me tell you a short story. Last year in August 2023, yes, that was last year, the Ministry of ICT launched the Digital Transformation Roadmap. The event was officiated by the Vice President, Her Excellence Jessica Alupo, and it stands on 5 pillars. One is infrastructure and connectivity. The second one is digital skilling. The third one is e-services. The fourth one is cybersecurity and data privacy. Cybersecurity.
Don't make us laugh ugly.
Anyway, so the fourth one is cybersecurity and data privacy, and the last one is innovation and entrepreneurship. Right. Dr. Ruth, do you think the conversation we are having today fits into this digital transformation roadmap?
Absolutely.
Gorgeous. Yeah.
Do you want me to say some more?
Yeah, all good. The floor is yours.
No, actually it's exciting, and I think that we need to interact a lot more with that roadmap. But absolutely, we were kind of impressed that deploying the innovation that Dr. Rose talked about, Call for Life, in Karamoja, actually reached out to so many people who were on the program. Over 50% of people who had come to the clinics that we worked in. We are working in 5 health centers. Over 50% of people could actually be registered in the system and utilize the system over the period of their illnesses. And it's amazing how much impact receiving health messages, being reminded about taking your medication, being given enough information at your convenient time. I think that for me, technology and all these innovations are going to allow us to now deliver services in a more humane manner, in a way that also meets the needs of individual users. So I think that, when you talk about connectivity, infrastructure, I think that is the foundation of all these things. Digital skilling, and we also want to see more and more healthcare workers getting comfortable using e-health services. I mean, that's what we're about, and we believe this is what the Health Innovations Conference is about. And we're really excited to hear that, this framework is coming and resources are going to be, allocated for this sort of thing, because it will just accelerate everything and make things possible for everyone.
Can I just add to that? Is one thing that we haven't mentioned yet is artificial intelligence. And I think that, artificial intelligence has the potential of being able to transform exactly the way that Ruth is saying, personalizing medicine for people, personalized training for healthcare workers, so many different things that it can do. But one of the problems that people are having at the moment is the guardrails and the frameworks. So these frameworks, like you're talking about, like the Ministry of ICT have set up, actually are so vital for those people who are innovating, because nobody wants to innovate in an unsafe manner. Actually, innovators want to be told, this is the line you'd cross, this is the line you don't cross. And, it's absolutely necessary that we have these frameworks that are both supportive of innovation, but also protecting local innovation from bigger people outside who can maybe do it, quicker than us or with more resources. But being an enabling framework that also protects the safety of the end user, the safety of the population, protects the data of the population, teaches the population how valuable their data is. And so all of these frameworks are absolutely essential. And we as health innovators welcome them, because actually we like to have guardrails. They make us feel safe. And we really welcome that. And I think in AI, this is the area where we're going to have a lot more discourse globally, because things are moving so quickly, but also in country around what those guardrails are and how we safely work within this environment.
That's so awesome. When we started the episode, you said this is the Center of Research and Development in Makerere University.
Yeah, sure, yeah.
What advice would you give someone who's hoping to pursue a career in this ecosystem?
Well, the first thing is to have the interest. And have the interest, reach out to people who are already in the space to mentor you and guide you. That's very crucial. And keep energetic and go and get it. Because the space, like you said, the opportunities are broadening. A lot of opportunities to study. It may not be Makerere University, but there are like 40 universities now teaching ICT and medical interventions. So all those opportunities are there for Ugandans to chase them, and there are also opportunities when it comes to industry after school. Again, the most important thing is to make sure that you're mentored, and then you have the zeal to match up the expectations of the private sector.
Yeah. Okay, that's great advice.
Thank you.
Yeah, I now want to also become an R&D expert.
Yeah,
I'll stay with communications for now. Dr. Ruth, sustainability. Let's talk sustainability. We talk about it in terms of climate change and other things, but what does sustainability look like in the innovation in health ecosystem?
Tough question.
I came with all of them.
I don't know whether I want to be the one to answer this question. Should I give it to somebody?
She's passing it on.
To pass it on.
So I think I can speak to that. So like I said, like Martin said, we have a lot of mortality rates when it comes to the transition between innovation and scale-up. Yeah. And a lot of that is because of funding. We're a very small economy. The private sector is still a little bit thin. And there may not be a lot of funding to support the innovation, but also the scale-up. But one of the opportunities to look at is cost sharing. There is a reasonable amount of cost that can be borne by the communities. Martin spoke, for example, to the model for the health innovations registration, where some people will not pay, but other people will pay some reasonable amount, those who can afford. And it's also possible that, for example, a community person may not afford to pay $10,000 to use the Call for Life system, but at least they can afford maybe $2,000 or $3,000, and then maybe the other party, which is maybe the private sector or the government or any other funder, can fund the rest of the bit. So that is one of the most important aspects of achieving sustainability. And then the other thing is to make sure that all the innovations actually fit into the National Development Plan and the priorities of the government, because ultimately the government is the biggest consumer of all the innovations. Whatever we do is really to accelerate government vision of transforming the country. Because if government takes interest in it, especially if you demonstrate impact, the government will take it up and take it up from there, and then that relieves you a lot of funding opportunities.
Yeah.
And then if you're lucky and you have a very good solution, so many tech companies will come in and get you. For example, the MTN mobile money solution, it started by demonstrating that you can transfer money wirelessly. And then it's now a $1 billion industry.
I think I was just reflecting on what Dathan is saying and confirming that actually it's a tough question. But definitely it all starts with how you start with your innovation. If you sit in the corner and come up with your idea, the likelihood that it will be sustainable, it starts with the design and the problem that you're answering. If you design an innovation where you know that many people will log in and use. I mean, for example, WhatsApp was a communication. I guess they knew people needed to gather together. OBs had lost touch. A platform like this would answer the question. It is likely that it will be sustainable. But definitely, if you look up at the consumers, especially for health, the largest consumer is government. Even for us at Academy, most of the innovations that we have developed, we know that at the end of the day, the biggest consumer of those innovations is likely to be government. So how aligned are you? And it's the biggest and toughest question. So you need to take time at the beginning of development to really think through and comb through, your purpose, why, and hopefully it doesn't end up like a pet project, something you just look at every day.
But there's also another aspect to sustainability, which is the impact on our environment.
Correct.
So, some of the projects that we're doing, for example, in the drones project, we want to actually evaluate the carbon footprint of the drones compared to these dirty outboard motors. We're looking about having cardboard drones, like recyclable drones. We have just been trying to work with a group to look at the batteries that we use for the drones and whether they can be shared with battery boda-bodas and battery motorcycles. And I think that because we are in a lower resource setting, we almost naturally try and do things with the lightest footprint on the planet. Because doing a heavy footprint on the planet is actually very costly for us. Big, expensive things that use lots of natural resources actually cost us a lot of money. So naturally, as innovators in this part of the world, we are much better at coming up with low carbon output solutions. We'll always use solar if we can, right? Because it's free. Okay, we will always recycle we will always recycle if we can, because we can't afford to buy waste our resources. But I think that's another aspect of the sustainability. Yes, is it in line with the government? But are we treading most lightly on the planet and treading most lightly on the resources of the end user that we are trying to do? Because both of those align with each other. If it's cheap to our end user, the likelihood is it's also not going to be threatening our planet so much. And those things. But what our role is, partly as an academic and a research and development, is to quantify that. Right? We have to quantify these things. We have to start thinking about quantifying the impact of our innovations on the environment.
Absolutely.
Yeah.
All right, guys, I am enjoying this conversation so much. I feel like we have talked about everything except these VRs that are in this room. I see them when we go gaming or when you're doing like tours. What do you use virtual reality for in this ecosystem?
So
I wanted to say so they are important tools for training. So IDI has a training and capacity building department. And, we train healthcare workers, for example, in operating in our surgeries. Oh. Yeah, so actually these can be used for simulation trainings, training drones pilots, for example. And you don't want to train them on the real drones, you first do it on the VR, IPC droning and other things. So we normally use them for training, but Martin, do you want to add any other branches that we can use them for?
You pretty much said everything. So we started out with mobile tech, Call for Life, and then we moved into emerging technologies. And when we look at emerging technologies, we're looking at things like virtual reality, precision medicine, artificial intelligence, and now we shall also be telling about quantum computing.
You guys are taking me very fast.
So imagine during COVID, it was very hard to train people because the likelihood of infection was very high. Yeah. So when you leverage virtual reality to train, to simulate situations, be it evacuation and stuff, we have been able to do that. So we have already functional modules where we're training healthcare workers on different aspects.
Yeah, using the
first aid.
That's amazing, actually.
Yeah, so for us in medical school, practice was
rudimentary.
But imagine if you do it previously, so you can identify a nerve easily when you simulated to know what a nerve looks, how different it is from a blood vessel. The first time you go into a cadaver room, everything looks the same when you cut. So that enhancement in training, it's really coming in handy, and it's cost saving as part of the sustainability.
So does the cost saving reflect in the bill of the person?
Yeah. So one of the things that we actually intend to do that we already do is we do a lot of health economics in most of the therapy. we have to understand what economic offsets do our innovations present on a micro and macro level. So at access, that is decentralizing access to HIV medication, we are task shifting at the health facility. So you have one nurse seeing like 80 patients. But now all those 80, 60 don't need to interact with the nurse. What is the impact on the health facility, on the healthcare worker, if you decentralize that access? And we also reinforce public-private partnerships through, some of our innovations like at access again, the medical drones. You're trying to make everything with a sense of local ownership. And that means the research we do to understand what you economists call
Cost effectiveness.
Cost effectiveness and opportunity cost. But from the health aspect, we do health technology assessment, HTA, within most of what we do. So, and health economics part of it. So, we are now graduating into emerging technologies, and we have a hub for artificial intelligence on maternal and reproductive health.
Yep.
So, things like that, and because innovations happen when government and policy are not ready. When you have a platform like the Hash Hub, where you have people doing a lot of things like artificial intelligence, it's easier now for us to go and have conversations with government. How do you own them? So we put all these aspects of sustainability, into the virtual realities, artificial intelligence. Precision medicine is coming up where the drugs will be designed just for you. Wow. And that will offset quite a lot of cost on the system.
And side effects.
Side effects.
Side effects.
This is like so. Yeah, I'm really happy that we're having this conversation, because where was I ever going to find this information?
And these things are happening in Uganda, and they're happening here.
In the Pearl of Africa. So, ladies and gentlemen, I want us to, the people who are listening to you, people who are watching you, and do you have any word of hope, of love, of encouragement towards anyone watching you? I'll start with you, Dr. Rose.
Oh my goodness. We have this amazing, vibrant, joyful young population. And you guys are smart, and you know what the problems are for your country. You really do. So start innovating. And innovating doesn't even need a laptop, right? One of our innovations was an arts project where we worked with older people and got them to do fashion design and self-portraits. You don't have to be a computer scientist to innovate. Artists can innovate. Artists innovate the whole time. Designers, the healthcare workers, educationalists, people who work in agriculture, people who work in finance. There's innovations everywhere. And, we can harness all of this talent, all of this excitement, and all of the young people in the country we have. And what we would say is, yes, find a mentor. Like Dathan says, find somebody who, is working in a field that you want to work. Most people are willing to help young people come up, and talk to people. Don't try and innovate on your own. It's a collaborative process.
All right. Thank you very much. That's actually really cool. Dr. Dathan.
So I just want to tell the young people that the idea that you have is viable. Don't give up on it. And I just want to tell you that you need to come to the Health Innovations Conference. we shall have a discussion on how you transform your idea into the real innovations. See you then.
Lovely. Mm-hmm. That was like a pitch, like a 111.
Nice one.
So,
Ambassador,
so I always get the question that, the difference between innovation and digital. I just want to make sure that people understand that innovation is not limited to technology. So in terms of process design, just extending the way things are being done is innovation. So don't think that we are only looking out for technology. There's so many other things, social innovations, insurance, financing, all these things are not directly into digital. So let's get that clear. And if you have an idea that is just introducing how things should be done differently, the Health Innovations Conference is a place for you to be, but also the Academy at IDI, the Virtual Reality Lab. We are open and always welcoming. We have mentored students from as far as Arusha, Dar es Salaam, And now they have designed products that are feeding directly into national systems. And we didn't charge them a coin. So it's testament to our intentionality to mentor, to train, and see things from people who are beyond the visual line of sight. How do their products come to life?
Yeah.
So,
This visual line of sight is what I'm doing. Yeah. Dr. Ruth, do you have words of hope, encouragement, or love to someone listening to you or watching you on the Ugandan podcast?
I like your words, Brandy. Love, hope, and I wish all those to you. I think for me, what I want to say, and I want to agree with Dathan, I want to pull up his lyrics. Simple is good. You might be in your place, you have your simple idea. Your simple idea is good as great. Does it answer problem? Then it's good enough. Step out and you're welcome to the Health Innovations Conference. Our promise to you, through Martin, is that we shall gather people who will impact your life. I hope that those 2 days will be very impactful for you. So join us on the 26th to 28th August.
And we will all be there.
Yeah.
And we shall all be there.
Yeah.
even Brandy has to be there.
Guys, I have to be there. How can I know? But also, adding to this issue you have been talking about of innovation is just not technology. Before I joined the ministry, I was working in the Uganda Child Cancer Foundation. And I gathered like a group of artists, and we started doing art therapy for the children during their chemo. And they'll just paint their dreams. Yeah. Some would draw their parents, some would draw the tree at home that they have not been under because they've been in Mulago. And then I did the Live It Up podcast to communicate about non-communicable diseases. Like, you just have to do what you can with what you have. Right. To whom much is given, much is expected. Ladies and gentlemen, this has been the Ugandan podcast. Do you want to tell us your socials where we can find you in case we are looking for you before or after the conference?
I'm on Twitter at Dathan, at Dathan MD.
Okay.
Yeah.
Okay.
Yeah.
You can also find me on X, at Ratanshi, but also the Academy is on X. The Academy is multiple YouTube videos. You want to watch stuff about the drones, they're available. The Academy website has got lots and lots and lots of links. And also personally, you can also find most of us, I think, on LinkedIn. Like if you want to, for mentorship opportunities and things, I think LinkedIn is the way to also connect.
Yeah, but did Elon Musk have to change the name from Twitter to X?
I don't know why he did.
That was his innovation. Dr. Martin, where can we find you?
So I'm almost on everything except Instagram.
Really?
Yeah.
How are you be on Instagram? Like,
I'm so old. Don't even know.
Are you?
But I'm on Twitter as Martin J. I'm on LinkedIn, and I think that's it. Yeah.
Actually, now that I look at you, probably think you're old.
I look old. I
Anyway.
need some more makeup.
I'm messing with you. Dr. Ruth, where do we find you?
Yes, on X as well, Obaikol, and on LinkedIn, Dr. Obaikol.
All right, all their handles are just below here, and you can find us at MYCT _ we're there as the Ministry of ICT and National Guidance on X, and then also on Instagram, MYCT _ UG. And I'm Brandy Valentine on Instagram and at Valentine Brandy on X. And you can find me even anywhere, really. And you can catch this podcast on Riffly, on Spotify, on Apple Podcasts, and on the YouTube channel of the Ministry of ICT and National Guidance. Before we go, has any of you watched Grey's Anatomy? No. Do you think I can become a doctor by watching all this tennis?
Good luck.
I think I would like to thank Brandy, the Ministry of ICT, for being so intentional. Yeah. And in the background, we have incredible people. Yeah. I'll mention their names.
Yes.
Charlie, I made this possible.
Yeah.
The Ministry of ICT.
Yes.
The team at IDI.
Yes.
Raymond, Rebecca, entire academy, ACE, the lab where we are at right now. They are always open to welcome people to show you, the virtual reality. And the leadership of the Ministry of ICT, they are very forthcoming at seeing things, transforming by working people. Dr. Anna Zawedi and the Minister. And
Honorable Chris Baryomunsi.
Yes, they are very intentional.
And Honorable Kayanga, yes.
So we are incredible that it's quite incredible that we are making this happen, and we await if the fruits start already, being backed out of this. So thank you so much to everyone who has made this possible.
Are you thanking us to bribe us?
We are
We are corruption-free zone. But ladies and gentlemen, thank you for joining us for this episode. We have had so much fun. I hope you have enjoyed every bit of it. See you at the Health Innovation Conference at Serena. And we say all this for good and our country. Bye.